Now, cell therapies, as we were talking about, in what we commonly think about are when we take those stem cells or T cells or other types of cells and modify them to turn them into targeted medicines. And most current cell therapies are created outside the body or ex vivo. Doctors first collect those immune cells from the blood using a process similar to what's done for stem cell transplants. And these cells can come again from your own body or autologous, or from a donor, which is allogeneic. Scientists can then re engineer different types of immune cells, most often T cells or natural killer cells, which are NK cells, to better recognize and attack cancer. Some of these are called CAR T cell therapies or TCR therapies, and the names depend on how the cells are reprogrammed. Gene therapies, as I mentioned earlier, fix or add instructions to make healthier or more effective cells at fighting cancer or other diseases. Gene therapy works by adding or changing genetic information inside cells to help them function better or replace something that's missing. One common method uses harmless helper viruses called AAV or adeno-associated viruses to help deliver healthy genes into the body. And this approach is already approved for some rare blood disorders like hemophilia A and B. And what's special about that technique is that it can actually be delivered entirely in a clinic using an IV infusion without removing any cells. And that's called in vivo therapy, meaning that, again, we don't need to use cell collection or transplant techniques. However, right now at least, most of the cell and gene therapies that are being developed focus on modifying cells outside the body, or again, ex vivo therapy, which comes with its own benefits because it allows us to do a lot more different things without worrying about these changes we're making to the cells affecting other cells in the body, but also come with their own challenges. And some of the techniques that we use are things like lentivirus vectors, as I briefly touched on earlier, that are retroviral tools that insert new genes. And you can think of a lentivirus like a delivery person dropping off instructions for how to get into and modify the cell. And most current cell therapies use this method to modify T cells. The CRISPR-Cas9 system is used for precision gene editing, and you can think of this like a cut and paste in your word processor on your computer to remove a typo or add a missing word. This is a higher precision method, but its uses are still being explored because, again, of risk of making cuts in areas of the DNA that we don't want to. And so this is still being worked on, but there have already been advances in this area to where there are approved gene therapies for some inherited disorders using this method. There's also two other techniques, one called short hairpin RNA, which is used to turn off certain genes. And you can think of this like a volume button on a remote that can turn off or on genes or sections of genes. And zinc finger technologies that are used to target or repair specific DNA spots. And you can think of this like a lock and key, where the zinc finger protein is targeted to a specific part of the gene of interest to change how much of that gene is used. Now, all these treatments begin with a process called apheresis, and that's specifically for the ex vivo treatments, I should clarify. And that's a special type of blood donation. It relies on a similar machine to what's often used to collect platelets during blood donations. And during apheresis, blood is drawn from one arm using an IV, passed through a machine that gently separates out the specific cells we need and returns the rest of the blood back to your body through that same IV circuit. Depending on the type of anti-cancer therapy, we often collect different types of cells. So this is one way we collect stem cells or CD34 positive cells, and these are the seed cells that regrow bone marrow, and they're used for auto and allo transplant as well as gene therapies. We can also use these machines to collect T cells, which are recognized by CD3, and these are the soldiers of the immune system that are trained to recognize and attack infections, cancer, or other unwanted cells. And these cells are collected for CAR T and TCR therapies. And then we can also use the same apheresis machine to collect natural killer or NK cells using the CD56 marker. And these are your first responder cells that can destroy abnormal or disease cells very quickly. And they're collected for some types of the upcoming NK cell therapies. The same basic collection method works whether the cells come from the patient for cell therapy or from a donor for donor-based therapy.